Hi, everybody. This is Kelly Ranney. This is my husband, John Ranney. Our first topic is, why is everyone losing their hair younger? Great topic. The first question that I'd like to ask you, John, are you truly seeing more hair loss in patients in their 20s and 30s?
We are seeing a lot of younger people now, absolutely. And I can't say that, more people are losing their hair at a younger age. It's possible, but definitely younger people are much more aware of it now. And that's obviously because there's a lot of social media out there. There's a lot more, it seems people are a lot more self-conscious now. And because we have good solutions, good treatment options, we have a lot of younger people coming in early and early. The other thing is, people want to, men and women, if they see their parents losing hair, they often rightly worry about their own hair. So we may see people even before they lose their hair. So yeah, we see a lot of people, and not just in their 20s and 30s. I have parents bringing their children in. So it's possible to start losing hair even before puberty, but really the onset can be any time from puberty onwards. So we're talking like 12 in women and 14 in men. Right. Somewhere around there. And yeah, I see younger people coming in their teens who have, significant hair loss, both men and women. So, we're seeing a lot of younger people now. Definitely.
So basically the hair loss in your 20s and 30s hasn't increased. It's just that there's more awareness.
Well, that's what I would think. Yeah.
Right. Okay. So how much does stress actually impact the hair growth cycle? Or does it?
Yeah, it can, but stress is a complicated question.
Right.
Stress causes a type of hair loss called telogen effluvium. And what telogen effluvium is it's mainly hair shedding. So a stressful event occurs, then a few months later, usually 2 to 3 months, it could be sooner, but usually around 2 to 3 months later, shedding begins. And it affects the entire scalp. So you shed equally from all over the scalp. It goes on for 2 to 3 months, and then it stops as the body has readjusted to this stress, and then the hair grows back on its own. So that's how telogen effluvium works. Stress, stress is a big topic. So when we talk about telogen effluvium, we usually think about specific stressors, events, illnesses. So COVID was a big cause.
Right, COVID was huge.
Of telogen.
We see a lot of patients that had COVID that lost their hair, eh, John?
Yeah. So stress is a big topic. So stress, aside from illnesses, can be, of course, emotional turmoil, right, major accidents, everyday stress that, people go through, say, with work or raising a family. Does this really affect hair growth, hair loss? We see some chronic telogen effluvium, so cases of chronic hair shedding that we often can't find the cause of. Is it possible that, a person's ongoing stress is affecting it? It's possible. It's probably very rare, though, that we have, our daily life stressors, bringing the kids to school, worrying about dinners, worrying about, financial concerns. These ongoing stressors of just life are causing telogen effluvium or chronic telogen effluvium. I don't think that that's a big thing. So stress affects hair growth usually in, major occurrences, so major stressors. Tragedy or major illnesses, especially illnesses associated with fevers, but even surgery, something like that.
So causing trauma to your nervous system, basically.
Yeah, any kind of trauma, be it emotional, physical.
It could be a divorce, it could be an illness.
So major events.
Events.
I do see a lot of women who have gone through a divorce and then suddenly started, losing their hair a couple months later. But the other thing that stress can often trigger is it can trigger trichotillomania. So trichotillomania.
That's another topic to talk about.
It is.
That's huge.
It is. But
we'll get there.
Yeah, and it can also, stress can trigger some types of scarring, alopecias too, and non-scarring alopecias like alopecia areata. So autoimmune-related hair loss can be triggered by stress as well.
I think we should do a whole podcast on all the stressors that can happen. So we'll circle back to that. Okay, John?
Sure.
Is social media making people more aware or more anxious?
Well, certainly people are becoming more aware. We talked about that a little bit already, but certainly social media is making people more aware. And I think the big problem with social media is it makes people more self-conscious. Because, everybody's judging everybody. Everybody has to look perfect. Everyone has these new, these new ideals that they're trying to live up to, and often it's impossible. But let's face it, I mean, any young person losing their hair, be it male or female, is going to probably be upset by this, and they're probably, more self-conscious because they're seeing more people on social media. They're just, you're just more out there.
Right.
So you're going to be more self-conscious because you're more out there.
Right. Well, that makes sense. So this brings me to what lifestyle habits are silently damaging your hair?
Okay, so lifestyle habits.
That are silently damaging.
Sure. I mean, there's a lot that people don't realize they're doing. So one of the major things is shampoo frequency, products that you're using, and these sort of things. So first of all, it should be understood that the amount you shampoo your hair, it is, partly dictated by, mainly dictated by your scalp condition. So if you tend to have an oily scalp, you should be shampooing more often. If you have a dry scalp, you may need to shampoo and condition, more often.
Right.
Most people, I shouldn't say most people, a lot of people have this misconception that it's not a good idea to shampoo your hair too often. And I even hear this from a lot of hairstylists, and I don't know why they say this, because there's no studies that show that washing your hair too often causes dryness or dandruff or hair loss or anything else. When we have a scalp condition that needs to be treated, we're usually treating it, at least 3 times a week. And people with severe cases of dandruff, psoriasis, seborrheic dermatitis, or the scalp condition, they need to shampoo more often. And they need to shampoo with the right stuff. So a lot of people, they don't shampoo their hair enough. So that's one of the lifestyle things that people need to change.
Because they think that they're shampooing their hair whenever, and they don't really think that it's going to be make a big difference with their hair loss.
Right. Well,
it's just shampooing your hair, right? That's what people think.
Yeah. Well, and I mean, the frequency of shampooing is not really going to affect your hair that much, really, like your hair growth, like cause hair loss. Yeah. But if there's a scalp issue, that can affect hair growth.
I see.
Okay. Now, damaging to the hair itself is another thing. So if you're using products with lots of alcohol, sure, they may be drying out the hair. Hair is a very strong, solid structure. It takes a lot to break it down. However, everybody knows severe heat, chemical processing. But some people's hair is fine. They grow it out long and the ends get really damaged just naturally. That's just normal oxidation. Mm-hmm. So you should be conditioning your hair regularly, and that might mean shampooing more often and conditioning more often. But using things like dry shampoo. So I really don't like dry shampoos. I see people's scalp all the time.
That's a great topic.
And your scalp gets a little oily, so instead of shampooing the oil out like you should be doing, you're spraying this stuff on it that just makes the oil congeal and turn into this dirty dust, and that's just going to cause fungal presence on the scalp to increase and cause nasty things to happen to your scalp. So this is something that could be damaging to hair and hair growth.
And people don't know it.
Long-term use of these dry shampoos, it would be a good study. Again, I haven't seen studies on it, but when I see people's scalps who use these, it's not.
They're destroyed.
It's not a pretty sight.
Yeah. So as a trichologist, you would not recommend
dry shampoo.
Dry shampoo.
No.
Well, that makes sense. How early should someone intervene?
For hair loss?
For hair loss,
So, well, I mean, as soon as you notice it should be dealt with. Now, men and women who are under 18, under 12, depending on the type of hair loss it is, may have limited options in terms of medications. So if we get an autoimmune hair loss happening at a really young age, we have to be very careful how we treat that. If we start to see, adolescents getting pattern hair loss, then we have to be careful how we treat that. We do not want to give finasteride to a 14-year-old boy, or even...
That's another topic. We're going to get into the finasteride.
Sure, no.
But
you're going to, intervene as soon as you're aware of the hair loss. You should be dealing with it.
So there's no age that you would say, no, you can't come into the clinic if you're 12. No, you don't have an age.
If you're losing hair, you got to come into the clinic, especially if you're younger, because if you're really young and you're losing hair, it could be pointing to some other medical issue that needs to be looked at.
Right. And you often see that with blood work and whatnot. What is the biggest mistake young patients make, John?
Biggest mistake young people make is probably...
Maybe, like you said, not coming in.
Yeah, not dealing with it might be the biggest mistake. But another big mistake that not just young people, but most people when they first start losing hair make is using, how do I put this? There's so much information out there or misinformation out there about hair loss on the social networks. There's so many people out there who are not really qualified to speak about it, but there's also so many companies promoting bogus products for hair loss that just don't work, have no research behind them, and that's again another topic we'll talk about. But the biggest mistake a person, especially a young person losing their hair, can make is trusting the internet to diagnose and treat their problem. They need to come in and see a trichologist. And, in Ontario, at least, seeing a dermatologist or your family doctor, that might be a first step, but they're not really trained in any in-depth manner with the different types of hair loss and how to investigate it and all these things. Right. Most dermatologists don't even take hair loss patients anymore.
Yeah, unless they refer to you.
Yeah, and sometimes we have to refer back to a dermatologist for specialized medical treatments, but most of the time we can start their treatment, get them going right out of our clinic. Mm-hmm. So coming to see a trichologist before you start any treatments is paramount. So the biggest mistake is starting a treatment before you've had your hair loss properly diagnosed and seen by a professional.
Well, that's great. Thank you so much, John.
Okay.
So that's it for today. Stay tuned for our next episode. The next episode topic is going to be female hair loss nobody talks about. Great topic. Stay tuned. Check out our next episode. Thank you so much.
Thank you. Have a great day.
Bye.